asking for wages that would be comparative to what the wage increases that our nurses at the hospitals, and tomorrow there'll be the sector long-term care home sector meeting where an arbitrator will be announcing what they have awarded. So we're asking for the exact same thing.
Okay, we're on strike. We've been on strike since January 30th. We are trying to get a fair and a collective agreement from our employer. Our wages have been froze for the past 2 years, and they're offering another wage freeze to us. So we just want what's comparable with the 57 other nurses across the province that ONA represents. Our concern is that if we start continuing with wage freezes, our wages are falling further and further behind other nurses, and we aren't going to be able to sustain having qualified people working in the community. So, we're asking the community to support us. We support the community. We're asking them to call the CCAC in London, call 310 CCAC, and ask them to get back to the negotiating table and negotiate a fair settlement with us, so that we can get back to providing the care in the community that we want to be able to provide.
Our care coordinators are highly skilled people. They have a very, very important role to play, and we very, very much want them back in the workplace, and I know they want to be there as well. They enjoy their work tremendously and have a big impact on patients. We have worked then very, very, very hard on our contingency planning to be able to maintain patient flow. We have many people who are not on strike, and so if a person receiving care in their home has a visiting nurse or a visiting therapist or a visiting social worker or a visiting personal support worker, all of those people are not impacted by this strike, and they continue to provide all of those visits. So that's a very important part of being able to continue going forward. And otherwise, we have a number of regulated health professionals who are not part of ONA, who have been redeployed to our priority areas, the first one of which is referrals out of hospital, but also placements into long-term care, placements into residential hospice, such as Sakura House there in Woodstock, as well as ongoing care plan changes that may be needed by our existing patients. And so far, through a lot of hard work of a lot of people, we have been able to maintain all of those priority areas.
What's going to go on until they bring a deal back to the table? We're prepared to continue to stay out on the picket. We are worried about our patients. We're concerned about the people, and we want to be back at work. We want to be working and doing and caring for our patients. But at this point, our only option is to be out on the picket line to get the message through to the employer that we want a fair and reasonable contract.